I'm here tonight to talk to our state about our needed actions in the fight against the COVID-19 virus. I'm pleased to say our state has organized a very strong and robust effort against this threat. We're seeing countless acts of commitment and community around our state. And these are both a sense of pride and a reason to be confident in our ability of this state to win this battle. But we have an obligation to ourselves and to our loved ones to recognize that this is a hard road ahead of us. That is why tonight I am extending our state's Stay Home, Stay Healthy initiative for an additional month. This order will now be in place through May 4th. Because the hard truth is that since I announced our Stay Home, Stay Healthy initiative, it was just over a week ago, the number of deaths that we have suffered and the number of confirmed cases has roughly doubled. And May 4th is absolutely the soonest we possibly could achieve our ends to keep our loved ones safe. Over 250 Washingtonians have died, and we have over 6,000 Washingtonians that have already tested positive for this virus. Each one of these Washingtonians is a loss, and each is an inspiration in the days ahead. So here's basically why we're doing this. We unfortunately have yet to see the full weight of this virus in our state. This order is not only justified, it is morally necessary. We are confident in our steps we have taken, but we cannot lose steam in the middle of this fight. Epidemiological modeling that is done at the University of Washington, it's one of the premier research institutes in the world today. We're so fortunate to have them in our state. And that modeling predicts we will have over 1,000 deaths in our state, and that there will be more if we do not continue our stalwart efforts. The science is clear. More people will die if we stop now. I'd like to show you a chart that informs us about this issue. This chart shows the cumulative cases per 100,000 population in 5 states. The most cases are in New York, the top line. The second highest line is New Jersey. Washington is the line in yellow. And the curve shows that the things we're doing appear to be working. They've given us additional time to build our hospital capacity to serve the surge of patients that may be coming. And this chart shows that our efforts can pay off. But I'd like to show you this second chart, one that demonstrates one reason why we need to keep going. This chart shows the percentage of tests that have come back positive over the last 2 months. And you will see to the right that these positive percentages are going up, which is a cause for concern. I'm telling you this to show you that actions based on smart, reasoned data and science can have a positive benefit and are in our state. We're not out of the woods yet, and we shall never flag or fail in our commitments to win this battle. We will not accept unnecessary deaths in our state. And I know that we need to think about all of the ramifications of this order. They are a heavy weight on all of us, including myself. We know that more Washingtonians will be in financially precarious positions through no fault of their own because of this virus. And we need to exercise all our efforts to find ways to support these Washingtonians. We've taken dozens of steps in that direction already. Under my emergency powers, we've exercised a moratorium on evictions for non-payment of rent. We've organized mortgage forbearance. We have provided utility ratepayer assistance. We have increased unemployment access. And we've provided flexibility on tax payments and cash assistance to families. We're pleased that Congress has given us funds to help the hard-pressed small businesses whose whole business plans have been so disrupted. And we think of the owners of small restaurants tonight, and we're looking forward to them reopening. It's one of the reasons we want to beat this virus as soon as we can, so we can get these businesses reopened as soon as we can. Because the fastest way to economic recovery is for a recovery of our health, which is fundamental to all we hold dear. So first, to save lives, to rescue Washington's economy, we've got to preserve lives and defeat this virus. And that is the only goal of this Stay Home, Stay Healthy initiative. As Franklin Delano Roosevelt said in his very first fireside chat in 1933, he says this to our nation: more important than currency, more important than gold, and that is the confidence of our people. Confidence and courage are the essential success in carrying out our plan. It was true then, and it is true now. I have confidence in the courage of Washingtonians, and it is already being displayed across our state. We really are in the middle of a massive mobilization, fueled by every sector of our state, to save the communities we love and to show the world that we will be committed to rebuilding them when we are past this storm. Part of that effort is the sacrifice of business owners who had to shut down and the workers who struggled to pay their bills. But this is temporary, and it is important for us to work forward to the ultimate conclusion of our efforts. Yesterday, I put a call to our manufacturers to begin producing the personal protective equipment that we need to help our healthcare workers, our public safety workers, and our essential workers across the state. You know, today hundreds of businesses are meeting this challenge already, and thousands more individuals are engaged their own time and their own resources as well. Some of your local shops and restaurants are still selling online or providing takeout service. And if they're closed, I hope people will consider buying a gift certificate for that business to use when this is all over. I'm thinking of all kinds of sacrifices people are making, like those of our nurses who are leaving their families and rushing into this dangerous fray. Nurses like Brandy Nakata, she's a nurse at St. Anthony's Hospital in Gig Harbor. She works with COVID-19 patients every day. Her peers describe her as a light in dark times, and boy, she sure is. I got to speak with her and her young son Monday over a video chat, and I just am so proud of what she's doing. I made her Washingtonian of the Day, and I think everybody would agree with that assessment. I'm also thinking of our members of the National Guard who are now in Washington State. They're supporting food banks so that people's basic needs can be met. By the way, the National Guard's role is not related to enforcement of their orders, just to helping people out. So there are no new restrictions in this bill. It does not reopen schools, although we certainly are having discussions about the next steps that our schools will take. And it is still important to reduce non-essential travel and non-essential contact with others. As I have said before, and I will say again tonight, all of us are leaders in this effort, and those who are watching out for their parents and grandparents and reminding them not to go out and defer visits to them so that we don't infect our loved ones of advanced age. This can make a life or death matter for our loved ones. It's springtime, Washington, I note that. It's still okay to get outside and get fresh air. It's very important for health. But our state parks are closed for a reason, so people don't congregate there and infect each other. It's tulip season in the Skagit Valley, but that festival is canceled for the same reason. I know that's painful to a lot of folks. We all love the tulips. But our office has heard large numbers of people are still trying to visit anyway, and that's just not safe. And the local organizers have asked people to enjoy the flowers around their homes this year and come back next year to the Skagit Valley. We hope you do that. And just because we're outdoors doesn't mean we can forget social distancing. This virus could still be outdoors, so we got to maintain that 6 feet on our walks around the block. So in summary, we are going to reopen our parks. We are going to reopen our restaurants. We are going to reopen our schools. And today is a big step towards doing all those things. Taking big steps is in the nature of Washingtonians, and that's what we're going to do. And I look forward to our victory in this effort. I'm joined tonight by Department of Health Director John Weisman, State Health Officer Dr. Kathy Lofi, and Vice Admiral Raquel Bono, and we will be happy to stand for your questions.
Hey, Governor, can you talk to whether this order might be extended again to May, if you'll have to reevaluate where we're at when it comes to May 4th for businesses to reopen on May 5th? Then also, I'm sure you saw today's numbers about the record number of unemployment benefit claims that the state is seeing. You talked a little bit about the long-term effort, but what are your concerns about the potential long-term impacts to the economy with these business closures?
Yeah, the first question is it possible that this order would be extended further? Yes, that is possible. We are very hopeful that because Washingtonians are being so committed to this, we would hope that this would be the conclusion. But the virus has a say in this, and what it does is something we will be watching very, very closely every single day. And I will just say that we will have more assurance that that would be the end, the more commitment we have to this order. And people are being profoundly respectful of this. We're so appreciative. We're having massive people who are cooperating with this order. And as that continues, we hope that May 4th will be the end. But no, I can't. No one can guarantee that. But let's pitch in to try to make it the last date. The question about unemployment compensation, as you know, there are massive numbers coming in of unemployment compensation. We expected that. We're building capacity to try to get those checks out the door. We're hiring over hundreds of people to try to accelerate this huge wave of applicants. I tell you, I look at this in two ways. It's sort of like we're in a lifeboat right now, and we're drifting towards an island, and we have two jobs. One is we got to keep the lifeboat floating, and we want to keep everybody's lifeboat healthy. That's why we're so happy to have increased unemployment insurance. It's why I'm happy I've done a ban on evictions of rent and mortgage forbearance. It's why we've got small business loans coming from the federal government that we can help accelerate. All of those things are to keep our boats floating. But when we get to the shores, we've also got to rebuild. And that's going to take all of us really committing ourselves to huge investments to restart this economy, frankly, like we did during World War II. And I believe that's going to be a very important part of our restoration of our economy. You know, despite the efforts for years, we did not get out of the Great Depression until the massive investment that was caused by the challenges of World War II. And that was the only thing that got us really going as an economy. I believe that after we get through this storm and keep people as healthy as humanly possible, we're going to need that kind of investment plan. And we know there's things we need. We know that we have infrastructure needs in transportation. We know that we have to rebuild our energy system so that it is not as dangerously polluting. So those are a two-step process. We're in step one right now. We've got to start thinking about step two as soon as we can.
Yes, Governor, people are looking for some sign that you'll be able to lift the order. What signs are you looking for that will tell you it will finally be time to lift the stay-at-home order?
Well, fortunately, as I noted, we have some of the best epidemiologists literally in the world right here in Washington State. At University of Washington, at the Institute, and our own public health systems. And we will be intensely dissecting all of the data to determine whether or not we can be confident that we have wrestled this beast to the ground. We'll look at the daily infection rates. We'll look at the tendency of the fatality rate. We'll look at the social interactions that now we monitor by both traffic patterns and patterns of internet and cell phone usage. We will look at the rate of hospitalizations of COVID-like symptoms. We'll look to see whether the weather might be of giving us some assistance. We'll look as to whether any therapies have developed. And when we can release ourselves to go back will be when we are confident that we have suppressed all of these data points to a level where we're confident that this isn't just going to spring right back up and bite us again. And so all of those data points count, and we're going to look at all of them to make a good decision. There is a legitimate concern by looking at other viruses that these things can return. And we've got to be alert to that to make sure that they don't. And fortunately, we've got a great research team and scientists to help us to make that decision. But I would just point this out. We're not just passive in the face of this virus. We're not just kind of victims of data. We make our own reality here. This is in our control. We have a big say whether we're done on May 4th or not, and that is whether or not we continue to socially distance. We have power in this fight, and that power is to use our heads to frankly interact electronically rather than physically right now. And that's a very powerful thing. It is in our control, and it's nice to have that control. And I say this because it would be easy to be fearful and be anxious. That's a natural human feeling. We all share it to some degree. But we got to realize we have our destiny in our control. We can control this. What we do is a decision we can make. And I think we're going to make some good decisions. I've seen a lot of people doing that.
Next we're going to Joe with the Seattle Times.
Governor, you've been talking, I know, a bit with your state budget director, and given the kind of shuddering halt that the economy's come to here, do we anticipate having to call a special session in Olympia to have lawmakers come back and make changes to the budget?
If it is necessary, we certainly will do that. I'll be doing some vetoes, I believe, tomorrow that will reduce some of the otherwise appropriated spending, and we're doing that to give us a cushion to deal with this anticipated severe reduction in revenues. So we're doing things, I'm doing some things, which by the way are very painful because I will be vetoing some really good things tomorrow that I believe in, that I care for, but we have to be fiscally responsible in this regard. So right now there's no immediate plans to call a special session, but we will be ready if we have to. I've talked to the legislative leaders, they're ready to spring back into action, and they have found a way to even, we believe, vote without having to be too close to themselves. So we'll be ready if we need to be.
Next is Drew with King 5.
We're looking for King 5. Drew will wait for you to come back later, we hope.
We'll go to Jim Camden with Spoken Review.
Yes, I'm wondering when the experts that are on this call expect the virus to peak in Washington, and also, are you recommending people who go out wear masks when they're out?
Kathy or John, would you like to answer that question? Kathy or John, if you're muted.
Yep, can you hear me?
Yeah, this is Kathy Lofi.
Yeah, hi, this is Kathy Lofi. I'm the State Health Officer. So I can address the first question. And that was the question about when we expect this to peak.
Did they call on me?
They did.
Yeah.
Hey, hold on, Drew. Hold on.
Drew, excuse me. Drew, we'll be back in a few minutes.
And I think our best estimates are from the modeling study that the governor talked about that has been done at the University of Washington Institute of Health Metrics and Evaluation. And according to that model today, they are predicting that the peak may happen sometime around April 11th. That is an estimate. And they are feeding new data into this model every day, so that peak kind of moves around as new data is fed into it. But that is one of the, I think the predicted, peak. We have heard that there is, a lot of discussion now, particularly at the federal level, around the use of masks in public, and we are in the process of evaluating, all of the current, data that's out there regarding mask use, and really do hope to, come out with some recommendations soon.
So we'll go to Drew now with King Back.
Governor, we're hearing talk that there may be some way to sterilize N95 masks, and that technology may be on its way to Washington State. Is that something that you've heard about?
I've heard some talk of it. I don't know any specifics about it. I know there's a lot of research going on about masks, which we're intensely interested in. And by the way, I want to thank the manufacturers like Outdoor Research that are going to be doing thousands of masks for the state of Washington. We hope other manufacturers will join them. John or Kathy, do you have anything to add to that?
Yes, thanks, Governor. Yes, sterilized masks so they can be reused, and that technology is arriving in the state and is being tested, and we expect that to be up and running very soon.
I also want to add that to the nurses, to the people who work in long-term care facilities, to fire and police, we are intensely committed to getting you protective equipment as soon as humanly possible. We are ordering literally millions of masks. Orders have gone out in the last few days. We continue to search the world. We continue to find some avenues of this material. We're energizing our manufacturing base to get you this protective equipment. We remain hopeful, although so far we have not convinced the president to really use his powers to get the manufacturing in place that we have in the United States to do what we need to do, which is to mobilize the whole industrial base of the United States to make these masks. And if he will do that, I'm convinced we will have a huge surge of these masks. I hope that will happen. And we've been a bit frustrated about this because when we look back to the World War II analogy, Franklin Delano Roosevelt, after Pearl Harbor, just didn't tell the states to go fight the war. He inspired the whole federal government to mobilize the industrial base to build the ships and tanks and B-29s. We hope that'll at some point happen sooner rather than later. We are desperate for this material, and we're doing everything we can to produce it ourselves.
Governor, I was wondering if there's another pandemic like this, what you think the state and the federal government should do once this current one is over.
Well, there's a cheery note, so we're glad you're here. I mean, obviously, if there's lessons from this, we will try to learn them. I'm sure that there will be, and we'll try to be as ready as possible. That's the best answer I can give you, and we're intensely focused on right here and now, and a little later in the progress, we'll have this discussion.
Yeah, hi, Governor. On the mask question, have you gotten any indication that production is ramping up? Are you seeing any sort of hope that you may see more masks shortly? And then you mentioned you'd be vetoing some things tomorrow. Can you give us an indication of sort of what areas you're looking at to veto?
The ones that need vetoing will be vetoed. And actually, that's not really true. These vetoes I will be doing tomorrow, the huge percentage of them are really good investments. They're for good programs. They're for a whole host of things that I believe in, things like early childhood education. And that's why it's very painful. But we have to be fiscally prudent. We have to realize that in the short term, the only thing we can do is to get ready for the huge reduction in revenues. In the longer term, there's other things we can do, but that's what we can do today. Yes, listen, we are going to be getting millions of masks in the next 4 weeks, literally. Because of the state purchasing, we are purchasing directly for distribution to hospitals and nursing homes and emergency service folks, literally in the millions. We're purchasing internationally. It's unfortunate because we've had to compete with 49 other states, rather than having a federal assistance, but we're getting really good success. We are manufacturing them. I mentioned outdoor research as manufacturing is going to be doing hundreds of thousands. Our prison industries are making surgical masks, and we're seeing some real creativity. I heard a story about a fellow over in Kitsap sort of designed a way to make a visor using his own 3D printer, and then he went to Keyport and asked them if they could start making them. So we're seeing a lot of creativity. I'm confident we will get that going, but we got to hurry up.
Yeah. Governor, as far as the situation with Boeing, voluntary layoffs, also going back to work pretty soon, and then another thing as far as guidance for businesses such as gun shops, gun ranges, who apparently have reopened. What's your guidance to them?
Well, we, of course, want everybody on this team. We have the vast majority of Washingtonians are on this team against this virus. If people are still on the sidelines who are not following this order, they need to get into the game. They need to pull their weight on this. It's hard, but if we're going to beat this, we're going to beat it together. So I would simply encourage everyone to be on this effort, be following this order, and we'll get through this. And the more people who do that, the faster this job will get done, so all of our businesses can reopen. That's the goal here.
Next, we're going to Jerry with Denver Herald.
Thank you, Governor. A related point, today's unemployment showed the largest spike to be in the construction industry. You were asked several days ago about residential construction, home building to be allowed as an essential business. Have you made that decision? If not, why not? Explain to folks why that industry is not considered essential.
Because we are going to have more people die if we make decisions that do not reduce the social interactions of people and putting workers in close quarters where they can transmit the disease and perhaps end up in them being a fatality, but also transmitting the disease to their families when they go home at night. So we made that decision. It stands. We have had some success with it. As I've indicated, these charts I've talked about, we've been one of the most successful states in the United States, in part because we have made these difficult decisions. That is a difficult decision. Look, I've got family members who are construction workers who are not working tonight, or at least doing the work they'd like to do because of this order. But if we're going to save people, we've got to take some of these measures. That's fundamentally the reason. Now, the other thing I will say is it's working. Look, the things we're doing are showing success, and that's what ought to give us confidence that we should continue on this road of not giving up. And so we've got to remain committed to this, and one of the reasons we have relatively good success relative to other states, it's because we have acted a little earlier and with a little more aggressivity and a little more compliance by our citizens. This is a sign of success, and we should not pull defeat from the jaws of victory here.
Governor, speaking of the success we've had, do we have a percentage of contact reduction that we've been able to achieve so far under your stay home, stay healthy order? And secondly, I know you're working very hard to get PPE into the hands of healthcare workers and frontline workers as soon as possible. We're curious how long it'll take to build up our stockpiles in the state after we deplete all of our resources to fight this immediate crisis.
You know, I can't give a categorical number, but obviously we will want to get a stable stockpile for many reasons to be ready for whatever comes. So we will be building that stockpile. As I've indicated, we have over 6 million, I believe, items of this headed our way that are in the chain, they're in the supply system tonight, in that pipeline. So it's quite significant, but it needs to go as fast as humanly possible. And as I've said, we need our local manufacturers to help us build that capacity for the long run, because frankly, we just can't depend on the federal government to help us. We can't depend on the federal government doing what it should do, which is to mobilize the entire manufacturing network of the United States to help every state. I hope that'll happen. There was another part of your question there, the first part. What was the first part of your question?
Yeah, so I guess I'm unmuted. The first part was asking, because of the success you've seen so far in the stay home, stay healthy order, do we have a percentage of contact reduction that we've been able to achieve in this state that you can share with us?
By the way, you weren't muted. I just forgot, so that was on me. Yes, the modelers today told us that they think it's in the range of 80% reduction. That's a good number in my book to be able to achieve that. And Washingtonians are the reasons why that has happened, because they have really embedded this concept in their daily lives that this is so important for them. And they have been willing to understand that the goal at the moment is to have as many people survive to see July 4th as possible. That's why we've been successful in having that maybe 80% reduction. And I want to show you this chart again to show you the difference this has made. If you can put up the chart with the several states. Sam, is that up? If you look at the chart, if you look at New York, and again, our hearts are so wounded for what's going on in New York tonight, which is the highest slope, and you see that slope heading up. You know, we could have been in that situation had we not acted. We could have been in that situation if we didn't have as comprehensive an order, a stay-home order, as we did. But if you look at where we are on the yellow line, that is a huge difference. That means people are going to be alive on July 4th that otherwise would not be. So we should remain both confident and committed here. And if we are, we're going to get through this.
Hi, Governor. Short of treatment or a vaccine, isn't it true that we would have to have widespread testing and contact tracing in order to safely lift these restrictions and avoid a dangerous resurgence in the fall? And if so, how close are we to having that capacity?
Well, obviously, we would have a higher degree of confidence if we have widespread testing. Now, we do have, even though we are very short, and even though we are trying to build testing capacity, again, you know, with our own state resources, yes, it would be better to increase it. We do have probably the second highest per capita testing in the United States, but we need dramatically more to do the type of testing that we would want to have a high level of or a higher level of confidence. Now, there are some scenarios you could depict where we had such a reduction of fatalities and known positives that I suppose we could be in a confident enough position to go back to sort of a more normal existence. I can't predict whether that will be the situation or not. What I can say, we've got to focus on what we can do today. And what we can do today is do social distancing, build our PPE capacity, build our testing capacity, and help people be in the lifeboat financially to get to that bright day when we can recover. And that's what we're committed to doing.
Next, we're going to Casey with Crime TV.
Yeah, Governor, you've spoken a lot about the need for more PPE production, but even beyond production, we've been hearing from nurses unions concerned about just transparency, just information on where these things currently are. So what sort of data does the state have when it comes to equipment levels and locations, and how much is it willing to share that data with the public, or at least with the nurses unions?
Yeah, well, the question is, I'd be happy to talk to the nurses. They are such heroes, and the physical therapists and the respiratory therapists and the maintenance people at the hospitals, the long-term care workers and the grocery workers who are feeding us right now. These people really are heroes, and they have a very legitimate concern about their own safety. What I can say is I will be happy to talk with them, and information that they'd want, we will try to get it to them. We would be pleased to share the orders that we have put out for PPEs to let them know what's in the pipeline. I'm going to ask them to help me, if you will, encourage other manufacturers to help come to make these products. Look, we need manufacturers to make a few less trinkets and cup holders and toys, as much as I love toys. and make more test kits and make more visors. And that's what we need right now. So I want to link arms with our nurses to get that job done. I'll look forward to talking to them.
We're going to take 2 more questions. Next, we'll go to Erica.
Hi, Governor Inslee, you mentioned that prison labor is being used to manufacture masks now, and I was wondering if you could give a little more detail about where that's happening and how much prison labor is going to account for the increase in supplies in Washington State overall.
I'm sorry, the increase in what? You cut out there for a moment.
In PPEs and other supplies that are needed.
I do not have a percentage or a number. I'll try to get that to you, but I've heard it's in the thousands rather than the tens, so we're very, very happy about it. I'm told that the incarcerated individuals are very pleased to have this mission statement, and we're glad that we've been creative enough to do this. And I'm told that they're doing surgical gowns now, but they're looking for the next order to fulfill as well. So we hope that that succeeds.
And final question will go to Paul with Bloomberg.
Yeah, hi, Governor. This is for John Weissman, Dr. Lofi, or Admiral Bono. What do the models show about whether the coming surge of COVID patients will exceed capacity of ICU beds? And if the surge does exceed capacity, has a disaster standard of care been completed or is it underway? And what kind of triage decisions are contemplated, such as access to ventilators?
Dr. Bono, do you want to tackle that one?
Yes, sir. Thank you, Governor. So based on the guidance that the governor gave earlier in terms of how we could preserve our PPE and working with the Washington State Hospital Association, all the hospitals across the state have been able to optimize their capacity. And so based on the modeling, we feel very comfortable that we've got the capacity in beds and in ventilators. We do have a concern with some of our ICU beds. And so working across the state and in the various regions, we're identifying ways that we can increase our capacity in ICU beds. But based on the current modeling, we feel that we'll be able to keep track of this and keep up with it. And a lot of this had to do with some of the earlier guidance that the governor gave to the businesses in Washington State.
We want to thank the 627th from Colorado, U.S. Army, who are setting up the field hospital in CenturyLink Field, too. That's been very important. We also have the Army Corps of Engineers is helping design additional facilities. We're looking at an additional one in Eastern Washington as well. And we want to thank the people who have had to postpone some of their elected surgery in order to allow us to preserve stockpile and beds and training for personnel. I know that's been an inconvenience and painful, but it was necessary to save lives. I want to thank people's cooperation in that regard.
Final words, Governor?
I just want to thank everyone. I am so pleased at the response of Washingtonians. They're pitching in. They're finding a way to get through their anxiety. They're calling their friends and neighbors to stay socially connected. And it can be, we all fall back in Churchill, but, one of the things he said in the middle of the Blitz, that he said, these are great days. And he meant it because we see the best of ourselves in moments like this. And we're seeing that across Washington, and we're going to keep it up. Good luck. Wash your hands.